So we're trying to look at individualization of drug therapy, okay? But we're kind of like looking at a clinical scenario, okay? So the full question is like, or the full topic is like factors to be considered. Like we're talking about individualization of therapy now, but focusing on what? Breast cancer chemotherapy. You get? So that's just how we're doing it. So they say that a patient is diagnosed with breast cancer and the patient is said to be commenced on chemotherapy. So what are the factors you will consider? So they are just trying to tell you about like individualization of therapy. How can you be able to what? Narrow down the treatment to just what the patient actually needs. All right. So definition. So for this patient, in order to achieve best therapeutic effect with minimal harm, that's individualization of therapy. You don't take what is given to this patient and apply to this other patient without making some possible investigations to know just what the patient needs. So individualization of therapy should be done for this patient. So individualization of therapy is what you are trying to tailor drug selection and drug dosing, all right, to a given individual. So for this patient, you do baseline tests just to know what the patient actually needs. Okay, so you need to do things like full blood count, liver function test, because if the patient's liver has a problem, how can you be giving drugs that need to be degraded by the liver? Do you understand? Then electrolyte, urea, and creatinine. They also do serology. This is because you want to identify if there is any other viral infections. You understand? So for factors to be considered, you try to know the race of the patient. Okay, so you know the race of the patient because there is difference in pathogenesis and pathophysiology of the disease and drug sensitivity. So it actually varies against what? Different races. Like for example, the way malaria will affect a white man, it will vary from the way malaria will actually affect a black man. Then gender. So special considerations in females. Age. Difference in drug handling and effect in different ages. This is ages, right? Sorry. And also a role of what? Autoregulatory mechanism. So liver function. Yes, because you have to know if the liver is functioning maximally, because most drugs are acted upon by the liver. Okay, so first pass effect and bioavailability, hepatic extraction, extent of biotransformation and hepatic clearance, influence of protein binding and drug distribution, renal function. So influence of renal clearance and metabolism. Alright, because most drugs, when they are broken down, the renal route is like the main route that they actually take to get out of the body. You understand? So you have to know that the kidneys are actually functioning rightly. The comorbidities. These patients, do they have any other disease condition? So influence of other disease processes, influence of disease on drug handling, benefits and adverse effects of the drug on other disease condition. Alright. So other concurrent medication, are they currently taking any other medication? So you are trying to what? Check all those drug interactions. Pharmacogenomics. So recognition of the individuals likely to respond adversely to some certain medications, and this is based on their gene makeup. The pharmacogenetics, influence of what? Hereditary or drug handling and the environment, Weight. So weight of the patient determines the dose of the drug to be administered. The economic consideration and environment. So a strong influence and determinant of access, right? Like, can the patient be able to afford the drug? Can the patient be able to what? Access the drug? Do you understand? Then also you try to understand the mechanism of action, pharmacokinetics, pharmacodynamics of the drugs. It's important so that you now tailor the drug just based on what the patient actually needs.